Thanks, Aaron. So tonight we have two of our guests, and that I'm really excited to hear about, building off of our last meeting we had a couple weeks ago. So our first guest is Jeff Luxembourg. He's from Hands on Hartford. And our second guest tonight will be Annie Scully from 211 United Way. So Jeff will be our first guest, and then Annie will follow, and then we'll have our questions and discussion, like Aaron said. Before we begin with Jeff, we're going to pass it to just Bonnie for an opening prayer.
The Lord be with you. Gracious and loving God, we give you thanks this day. As we give you thanks, we also ask that you be present to us, that you help us to open our hearts and our minds to those who are in need of food, to food security issues, especially at this time of season when we are thankful for so much. Give us understanding hearts and questioning hearts as we progress through the evening. We thank you for our guests who are speaking with us this evening, especially Jeff and Annie. And we ask that you be with us. In Jesus' name, I pray. Amen.
Thanks, Bonnie. So Jeff, whenever you're ready, just take it away.
Sure. Thank you for that lovely opening prayer. And also thank you, Dylan, and to the whole group for inviting me to join with you this evening. And thank you, Annie, for being a co-guest. It's nice to see everyone on Zoom. I'm actually Zooming with you live, so to speak, from Hands on Hartford, our office here on 55 Bartholomew Avenue in Hartford, Connecticut. And we are a human services nonprofit, and we focus on the areas of housing, health, and food. And I think what you want to hear about most, though those are our three core areas, and we provide those services for the greater Hartford area. I think what you want to hear most about maybe is the food bucket of our three buckets that we operate in. It's hard to describe what 2020 has been like to be a human services provider meeting basic human needs during the 2020 pandemic. It's been an emotional roller coaster. We have had to essentially rethink and redo every service we provide. Our food pantry has been revamped. Our hot community meals program for people has been changed at least 6 times as the COVID numbers have gone up and down to comply with all of the safety regulations. Our backpack program, where we provide nutritious food to food insecure children at 9 Hartford schools, was delayed as the school openings were being figured out and has had to change repeatedly. What Hands on Hartford is facing is not, I think, unique. As you look at maybe other nonprofit providers that are in this space, and what we're dealing with is kind of an interesting triple whammy, in the sense that we have seen a massive increase in the need in the community. So, for example, our Manna Food Pantry, which we're very proud of, which is one of our core food programs that's open to the community. That food pantry used to have between 500 and 600 households that would visit that pantry a month to get food to help with the food insecurity that they may have been facing at the time. Our numbers now are over 900 households a month. And so when you go from 500 to 600 a month to 900 a month, you're talking about thousands and thousands of extra pounds of food that we have to acquire every month just to meet that dramatic increase in need. At the same time, Hands on Hartford is a volunteer-driven organization. So We are a Points of Light affiliate, which is a national volunteer network, and we're the only Points of Light affiliate in the region. And we rely on 3,000 volunteers a year to help us do all of our programs. But most of our volunteers were people who you might describe as immune compromised now. And so when COVID hit, we lost, and corporations in Hartford, we used to provide a lot of volunteers. So we lost almost at one point 90% of our volunteers that were providing those services. So on the one hand, you got this massive increase in need. On the other hand, you have a almost complete elimination of all the volunteers that we work with to meet the need. And then the triple whammy is many similar nonprofits in the region, other food pantries, other programs providing hot meals to people who are unsheltered or dealing with homelessness, other programs that might be providing nutritious backpacks to children in schools that are facing that were facing food insecurity. Many of those other providers shut down because of COVID. And so that's kind of I guess I would say the triple whammy landscape that we have been facing: the increased need, the reduction of other providers to meet the need, and then internally the loss of our volunteers. So what we've done is we've all just worked really, really hard. We're proud of that we never closed one day. We never have turned away anybody for services that has showed up with a need. And we've had to think outside the box and do things differently. So at one point we had, instead of having our food pantry guests shop and pick the food items themselves in our pantry, which is the way we normally like to do it, and the way that is more dignified, frankly, for the clients. Our pantry was too small for that at certain points throughout this virus, where it wouldn't be safe to have people shopping in there in a small space. So we reworked it and moved it outdoors, and we spaced people out 6 feet or more apart, and we had runners deliver bags, and we would pre-make the food bags, and we'd have hot, we'd have wet bags and with milk and eggs, and then other bags with with other food staples. And so we'd innovate. And for our hot meals community day program, normally people would come in, get a hot meal, volunteers would serve our clients restaurant style, and it would be a chance for our clients to interact with each other, interact with our staff, develop relationships with our social workers, and help get them into different services that they may need. That has been transformed to a grab and go program, where we bring people in out of the elements, we get them the food they need, we get them access to a restroom and other services they need. But we then had them, take their food to go, so that we wouldn't have large gatherings in a small space. But everything like that, we established a crisis fund, because the cost to a small nonprofit, we're only a $4 million operation, but the cost of COVID, we were looking at when it first hit, we were estimating might be between, 1 and 1.5 million. So how do you come up with $1 to $1.5 million that you weren't expecting to need to raise, right? So we established a crisis fund, and everybody at Hands on Hartford became a development director, even if that wasn't their job, because we all had to figure out, what are we going to do to do this? Because we made the decision, and it was a leap of faith. We started out as Center City Churches 51 years ago, and now we're Hands on Hartford. So there's a great tradition of faith here at Hands on Hartford, but we had to take a leap of faith when this virus hit, knowing that it would hit the people we serve the hardest. That we weren't gonna ever shut down and not provide services. So we've been providing them with masks. We've been providing them with face shields. We've been swapping out shifts. We've been decompressing the building. It's been an unbelievable experience with a lot of highs and lows. But one thing that has really been amazing is all these different groups, faith groups, corporate groups, individuals, college students, people have stepped up and said, I'm healthy, I'm not immunocompromised. I want to, and I know there's a need right now. I want to come in and volunteer. What can I do to help? Or, we have this Faces of Homelessness Speakers Bureau where people with lived experience with homelessness speak to different groups and they tell their story in a compelling way. Well, they learned how to do it via Zoom. And in one of their Zoom presentations, there were people who Zoomed in from all over the world. So this is a program that never would have reached anybody outside of Connecticut before COVID. But because we had to adapt and we had to change that presentation to a Zoom presentation, there were actually students from all over the world that Zoomed in and got to learn about what it was like, not the stereotype, but what it was like for a lot of folks who dealt with homelessness at one point in time and overcame it. And so there's been all these incredible silver linings like that, and all these incredible displays of generosity that have really motivated us to keep going in the trenches here and provide these services. And we're just really excited about it. We're really, really proud of the work we're doing here. So that's kind of a broad overview of who we are and what we do and how things have been impacted during COVID. And I don't want to speak any longer because I've been way more long-winded than I had expected. So let me end there, and I think Annie's next, and then questions, if I got that right in the program.
Yeah, that's perfect. Thanks so much, Jeff. I appreciate it. And that's really just unbelievable to hear that. So thank you for all of that. I'm going to pass it off to Annie next, and then we can come back for questions and discussion after that. So Annie, thanks so much.
Awesome. And Jeff, thank you so much. And I kind of want to, before I really introduce myself and United Way of Connecticut and 211, I want to thank Jeff and Hands on Hartford, because early on in the pandemic, just as Jeff said, they did everything they could to respond to the need and to be creative and to be intentional with the type of support they were providing for residents across Hartford. And for 15 weeks, Barbara, Janet, and Tabitha on your team worked with myself and with Angie Pearson, who's on the Zoom meeting this evening, to provide food boxes that we delivered to homebound permanent supportive housing clients. So 15 weeks, 40 clients were served, and that was above and beyond all of the others, the work that Jeff just described his team was doing. So you're absolutely right. Throughout this pandemic, it really has been an unbelievable team effort across the state. Not just in Hartford and all of the major cities and our more rural areas across Connecticut. And we're really all in this together. And it's been really, really inspiring to watch how all of the agencies across Connecticut, all of the community partners across Connecticut have come together to really make sure that those most vulnerable populations were taken care of, knowing that they were being hit the hardest during this really difficult time. So I'll backtrack a little bit now and introduce myself. I'm Annie Scully. I work at United Way of Connecticut. And we operate 211, which is a 24/7, 365 days a year, 7 days a week, information and referral service. Just by a quick show of hands, for those of you that are sharing your videos, if you've heard of 211 before or dialed 211 before, can you just put your hand up super quick? I love it. It's always funny. There's times I walk into a room to give a presentation, or I guess now on a Zoom to give a presentation, and people have never heard of us. So I always want to make sure I kind of level set before I go into too much detail. So I'm so happy to see that many people are familiar with 211. And so at 211, we, in addition to providing, traditional information and referral services, we also are a certified crisis line. So our contact specialists, we have about 50 full-time contact specialists that man the phone, all with at least a bachelor's degree, can from one moment to the other be handling a very traditional, I lost my job and I'm looking for help finding a new one, or a resume building workshop, to the next call being someone that's literally in a crisis, is having, suicidal ideations, is has a child that's having an emotional or situational crisis. And I can't say enough about how wonderful they are at navigating each and every individual call to make sure they're connecting those individuals with the help they need as quickly as possible. And during this pandemic, that role has been even more difficult. And I'm so proud of the way that our team has stepped up to handle these new challenging calls. In early March, we were activated by the Department of Public Health to stand up the COVID-19 public information line. So in addition to all of our traditional calls that we handled, almost 400,000 requests for service from individuals dialing 211 each and every year, we are now handling a whole new set of calls. And out of the gate, they were really difficult because nobody had answers to the questions that were being asked. So people calling, asking about, before we knew whether or not to wear a mask, asking should they wear a mask. Before we knew how COVID-19 spread, people were asking our contact specialists, what do I do to make sure that me and my loved ones stay safe? And so we've been working really closely with the Department of Public Health to make sure that we are gathering information, we're vetting that information, and we're disseminating consistent and accurate information to everyone that dials 211 and to everyone that visits www.211ct.org, which is our website. And it's been tough, just like Jeff said, it has not been easy. And in addition to serving sort of that contact specialist role, that human touch that we know so many people, especially those elderly, health compromised, need right now and needed and will continue to need. Maybe they've been home alone, maybe they've been isolated, and 211's been that friendly voice on the phone to make sure that in addition to providing that support and providing that referral, we call it our warm line. They're there to tell people it's going to be okay. I'm here with you. A lot of people are in the same boat and we're going to get through this together. We've also been managing the other side of the coin, which is our database. So we have a database of more than 40,000 programs and services. Many of those programs are like the ones that Jeff described. They're from a single agency that does so many wonderful things. And what we do is we document and maintain all that information across the state. And so obviously during COVID-19, all of that information was changing and changing rapidly. So we have this living, breathing database that our information services team has been working hard to update to make sure that changes in services, the scope of operations, the landscape of health and human services that are being offered across the state has been updated so that people looking for help are getting the information they need, they're getting accurate information, and they're able to connect with that help while simultaneously capturing all this new information to make sure they could share it accurately with the general public and with people that were seeking that really important guidance. And so today, I know the focus is food, and I know I just already talked, Jeff, I'm with you. I'm more long-winded than I ever anticipated. I know I already talked a little bit sort of about the high-level role that we've played throughout this crisis, but I want to talk a little more specifically about 211's role during disaster, during emergency response, because believe it or not, we actually drill for this type of work, every year to make sure that, if something like this occurs, no one could ever have predicted that we'd be in a situation like this. But if, there's a hurricane or any kind of widespread emergency disaster or any kind of other issues across the state, widespread power outages, that we are ready to stand up and operate within the state of Connecticut's emergency response framework. Within that framework, we serve as sort of the gateway to services, and our functions. 211's functions include that information dissemination role, rumor control, that connection to services, which we always provide, but we know is so much more important during times like this. We provide daily situation reporting to the state of Connecticut. We help to coordinate volunteer and donation. We monitor call trends, and then we also do sort of more intentional direct care work. So we help individuals who need temporary hotel placements. We help individuals connect with transportation if they need to be transported from their home to someplace safe to stay while they're quarantining to make sure their loved ones stay safe. And we also do case management coordination. So since early March, when we first stood up the COVID-19 public information line, our 211 contact specialists have handled nearly 77,000 calls. And each one of those calls, we are documenting caller needs, and then we're reporting those rumors or those trends to the state's emergency operations center so that they have that data and can use it to make the best decisions possible to serve our state. And so what we do is every week we look at call trends and we report rumors and trends once again to the state. And so this last week we saw that we had just under 2,500 calls on that COVID-19 line, which is about 27% higher than the previous week. So I'm sure it's no surprise to any of you that COVID-19 is it's not going anywhere, and this second wave is hitting people just as hard, if not harder than the first wave. And the types of calls that our contact specialists are receiving and the type of help they're looking for is mimicking the kind of calls we were receiving in late March and early April. The requests for food continue to be above and beyond one of our top trends, our highest calls that we receive into the contact center. And so comparing this week to last week, we saw a 22% increase in requests for food. So once again, not to keep calling out Jeff, but we have noticed an exponential increase in the need for food and for the need for agencies like Hands on Hartford to be creative in the way that they meet that need for their residents. And so in addition to food, we saw an increase in information that people are looking at regarding testing locations, so people that dial 211 to look for testing locations. We also continue to field questions about the appropriate ways to quarantine and if and when they have to quarantine and what to do if they think they have COVID-19, what to do if they think they've been in contact with someone with COVID-19, questions about new guidance from the governor and new phases that we're in as far as social distancing and if and when they can go out to dinner or if or when they can go into their favorite shops and stores across Connecticut. So a lot of different questions. And our 211 contact specialists are doing a great job of fielding those questions and providing that consistent response. So if we look, and what I might do actually really quick is just share my screen. I don't know if that's going to mess everybody up, but I'm going to go for it. I'm going to show you this slide right here that I was looking at a little bit earlier today that shows data from March of 2019 to November 17th of 2018, and then compares it to 2020 March to November data. So I don't know if you guys can see this. Maybe I can make it a little bit bigger. But as you can see, across the board, we've had a 463% increase in our total volume.
It's not shared, Annie.
No, we can't see it, Annie.
Oh, geez. Sorry. Let me try it one more time here. How about now?
There we are.
Yes.
Perfect. Okay. So we've seen a 463% increase in total inquiries to 211, which means our website and our call volume, which is huge. And, every day our contact specialists, we field calls about basic needs assistance, referrals to community resources, financial stability programs, so on and so forth. But COVID-19 has exacerbated so many of those issues for so many people and also created issues for people that have maybe never had to ask for help before. It could be for many people the first time they're looking for a food pantry, the first time they need help because they've lost their job. And so our call volume is, to put it lightly, through the roof. We're getting calls left and right from people that are really up against a wall and really need help. At the same time that those agencies, those community resources, those programs, just like Jeff said again, are struggling to, field volunteers are struggling to keep their doors open so they can provide that service. So it's been challenging to find the right kind of help to connect people to. And if we look across the board at the top increases, the notable increases, we see first and foremost those requests for healthcare. Within that category is our COVID-19 category. So once again, more than a 6,000% increase. And that's almost exclusively driven by questions around where can I find a COVID-19 test? What are the signs and symptoms of COVID-19? What do I do if I think I've been exposed to COVID-19? Can I send my kid to school if I think I have COVID-19? Any question you can think of relating to what to do and how to do it if you think you've been in contact with the virus. Second on that list is food. And once again, that's been a huge, huge need for so many people across the state. And if we look at the data and compare it to this time last year, we see that we've had more than a 450% increase in requests for food. So that includes food pantries, home delivered meals, soup kitchens, and home, what I'm trying to think of other categories, SNAP and WIC. So people that for the first time are applying for those public assistance programs and have no idea where to start that process. And so all of those calls, all of those online inquiries are going through 211, and we're doing our best to connect people to the help they need. Utility assistance. So we've seen 139% increase in individuals that are seeking help to pay for their heating and their water bills. And likely that's because they're out of work or they've lost hours at work. Employment and income assistance. We know the Department of Labor worked so hard early on in this pandemic to field all of those unemployment requests. And we've been fielding a lot of those calls from individuals and providing guidance on how to get connected with that help. So we've seen more than 100% increase and from individuals seeking employment and income assistance. Housing and shelter, finally, those are those requests for rent and mortgage assistance, that eviction moratorium and the temporary housing assistance initiatives that the state's put out has really helped to keep people safe and keep people housed during this time. but we know that those are not going to be permanent programs that are around forever. And we know that eventually people are going to be asked to pay their rent. And if they haven't been able to find new jobs or haven't been able to make up for lost income, it's going to be really hard for those families and for those individuals when they're asked to pay their rent. And so to kind of try to end on sort of maybe a more positive note, 211 has been trying really hard to keep people in the know and in the loop about various community resources they can connect to, the types of help they can seek out. So either dialing 211 or using our 211 website to access that information is something that one way that you can sort of amplify that message is by telling your friends and family, by telling your coworkers, telling your loved ones that if you go to www.211ct.org and click at the banner on the top of the screen, you'll see that there is a link that will bring you to this 211 resource guide. Our information services department is updating this continuously to put the most relevant information related to COVID on this one-stop shop page so that anyone that's seeking help can start the process by looking through those resources. And so, what I might do is stop sharing my screen and kick it back over to you, Dylan, to if I can figure out how to do that.
Yeah, no problem. Thank you so much, Annie. The graphic especially was really powerful. My gosh. So yeah, at this time, I guess I wanted to open up to anybody with any questions about what we heard. It's a lot of information, and I'm curious to hear people's thoughts. You can jump in, Jack. Go for it. Yeah.
Yeah, I have a couple of questions for Jeff. One is, these are easy questions. What do you need from churches, or that churches might be able to provide?
Yeah, that's a good question. Thank you. Thank you for the softball question, you could say. So, I think sometimes in the nonprofit sector, we're afraid to talk about money, but the reality is we need financial support, and the reason we need financial support is we have to produce more services for more people that are in need because of this pandemic, and we have fewer volunteers to do it. So we have to pay. Plus, there's all these additional expenses of just making our facilities COVID safe, all the PPE, all that stuff. It's just the costs are astronomical. And the only way to deal with that is financial resources. So we try to just be bold and direct about it, even though it's not a topic people are comfortable with. Say, look, the other thing is that I think sometimes people forget or their eyes glaze over when you start talking about money for nonprofits is we have all these incredible partnerships. I mean, we refer, our clients, we connect our clients to 211 all the time. And we have other amazing partnerships with organizations like Food Share and all sorts of large scale distributors that we work hard, food distributors that we work hard to partner with. And because of all these relationships, we're sometimes able to leverage financial support in ways that I think would surprise people. So I like to say sometimes if someone donates $10 to Hands on Hartford, they may think, well, what is that going to do? Well, in certain cases, we might be able to buy $100 worth of food with that $10 financial donation, right? So if we can leverage something like that and have a multiplier effect, that can be really powerful. But we also need volunteers for our core programs. And we work hard to keep them safe with masks and face shields and social distancing. So we're always in need of volunteers. And we have a volunteer orientation and a volunteer application. And then we sign people up for like regular weekly shifts, either in our food pantry or in our hot community meals program. So we're always looking for great volunteers in addition to financial support. And then, specific food items are very helpful for our food pantry and our kids backpack program. So right now, mac and cheese is an important food item that we need more of. that we have trouble sourcing from some of our partners. So that's a good item to donate, as well as canned soup with protein, so like chicken noodle soup, beef soups, any kind of soup with protein in it is a very attractive item for us to be able to help folks in need. So those are a couple things, but also we need audiences for our Faces of Homelessness Speakers Bureau. We need churches and faith groups to allow us to do a short Zoom presentation to your congregation where you get to hear directly from one or two people with lived experience with homelessness. And it's just going to completely transform the way people in your congregation think about homelessness. Very, very powerful program. And that's another thing you can do to help us is allow us to do one of those presentations. So that was a long-winded answer. Sorry about that, Jack. There's so much you can do to help.
Well, yeah, I appreciate that. And let me ask one more question, and then I'll wait a while. But I'm curious how it works out with your pantry program and your meals program and everything else in terms of cultural differences. Are you able to tinker with your program to meet those differences? Because we got them in town here.
Yeah, it's a great question. Our food pantry is one of the only food pantries in the area that actually provides halal food to the Muslim community, and we work with the Connecticut Muslim Coalition to do that. And so we're really proud of that if a Muslim individual or family comes to our food pantry, we can actually meet that need and provide culturally appropriate food. But that's expensive too, to be able to do that, but we're proud to do it because it's important. We also, our team is bilingual, and we serve people regardless of what their documentation or immigration status is. And we have folks working right there in the food pantry who are bilingual, so we can handle language barriers. So I think we're trying really, really hard to be culturally adaptive and sensitive to what the cultural needs are for the people that we're serving.
Thanks for the questions. Bonnie, you have your hand raised. You want to hop
Yes,
in
I
next?
do. This again is for Jeff. I have two questions. The first one's probably a quick, simple answer, and that is mac and cheese, individual cup servings or box multiple servings?
Oh, good question. We actually need both.
Okay.
Because the individual cup servings would probably go better into our backpacks for our nutritious backpack program, so that the children in some cases are literally making their own mac and cheese over the weekend for themselves so that they can show up to school and not be hungry on Monday morning. Very important. Very, very important. And then the other packages that provide more than one serving, those are also critical for our food pantry families, because we have adults shopping in the food pantry who need to be able to provide mac and cheese to their kids and may need more than one serving at a time. So both are extremely helpful. Okay.
And this question is probably for both of you. Typically, do you have a seasonal surge at this time for needs for food and housing without COVID and the surge that we're expecting to happen again now? So I'm wondering if the needs are going to increase just as normal seasonal needs increase for you typically. And then on top of that, your needs are going to increase with perhaps the increase in COVID cases and places shutting down again.
You want to go first, Annie?
Yeah, I can take a stab at that. So
Okay.
so seasonally we absolutely see like a spike or an uptick, if you will, in requests for utility assistance and housing and shelter assistance as the months get colder. So you're absolutely right there. For food, it's a little bit more of a over the summer, because so many kids are out of school. We get a lot of requests for summer meals programs information, because a lot of kids do get that free breakfast and lunch program across the state. Sometimes during the school year, we don't see a big upswing, but around the holidays, we certainly do. So Thanksgiving and into the winter holidays, we certainly see a spike in food need, but not necessarily just in the November and December months traditionally. That being said, we saw sort of an all-time high need for food peak in April, and we're beginning to see that sort of climb once again. So I wouldn't be surprised if we hit or surpass that count, by late November, early December.
Yeah, and if I could just add to Annie's answer, interesting challenge with the holiday season. Many of our clients that come in for our hot community meals are unsheltered individuals who are now facing the cold weather outdoors in a scenario where it is harder than ever for them to get indoors because of the COVID restrictions around indoor gatherings. And so I think that's creating sort of a unique holiday season challenge for us this year is, so we're, we need warm socks. I mean, we're giving folks socks because we're understanding the reality that they're going to be out in the snow, rain, and cold, probably, unfortunately, more than ever. And they're going to need warm socks just so that, just as the most basic health thing, that's probably more important this year than ever. The other thing I want to mention about the seasonality and the timing relates to housing. As many of you know, there have been a number of government measures that have been put in place over the last several months to try to keep folks from losing their housing. Many of those programs are running out or have run out. And so we are all fearful of a tsunami of evictions and housing trouble coming our way soon. And it's not just me saying that. I mean, you can look at Fannie Mae and housing data, and also, I mean, you can look at a lot of different economic indicators. There is going to be a tsunami of people losing access to housing. And I don't think, frankly, any of us at some level are prepared for what that's going to look like, but it's going to be happening, I think, soon at a time that is not good. So I think all of us need to think about, how are we going to adapt our services to meet those needs when all of a sudden, hundreds of thousands, maybe millions across the United States find themselves with an eviction and nowhere to live, and it's the cold winter and there's COVID, right? That's a scary thing coming our way that we need to prepare for. I should say, also of interesting note, Hands on Hartford does not receive any government funding for any of our food programs. And most nonprofits that are providing food resources or food to families or individuals with food insecurity don't receive a lot of government or any government support. And so that's why I think, probably Annie and I are both here on an evening because the faith community is so critical, right? I mean, it's not like there's a line around the corner of other entities or other groups or government funding stepping up to the plate to meet these needs. These needs are massive, and there's not a million sources of support. So I think we're just appreciative to have the opportunity to tell you about it, and anything that anyone on the call could do to support United Way and 211, which we use every day. It's so vital to all nonprofits in the entire state of Connecticut, but also to support us at Hands on Hartford is going to be just make an incredible difference, because frankly, government doesn't generally, with some exceptions, do a great job at this.
Yeah, just to piggyback on that super quick, Jeff, I totally agree with you. And we, United Way of Connecticut serves as the state association for our 15 local United Ways scattered across the state. And they are, just like Hands on Hartford, so ingrained in their community, so in touch with the needs on the ground. And our tagline is give, advocate, volunteer. So any way that you can support your local United Way, I don't know where, I know generally where you guys are based on the regions that are defined in this group, but contact your local United Way, go to their website, and they are doing everything they can, just like Hands on Hartford, to meet those needs.
And does United Way have a cousin in Waterbury or Torrington or anywhere in the northwest part of the state?
So United Way of Greater Waterbury they are Christian Jacoby, who's so wonderful, is the CEO, executive director at United Way of Greater Waterbury, and they are doing really incredible things right now to get ready for Thanksgiving. They're doing turkey drives. They're getting ready to deliver Thanksgiving meals. They are really a wonderful United Way, and if that's the area of the state you're in, that would be your local United Way. So if you Google United Way of Greater Waterbury, their website will pop up and you can learn more. And I can certainly provide information on all of those United Ways to you guys.
Great. Thanks, Annie. I wanted to note Jeff Hahnemann's question, which you kind of touched upon and answered, but is there a specific way that, 211 is broken up across the state, or how is that? Can you speak a little bit to that?
Yeah, I didn't see that question, so thanks for calling.
No problem. Thank you.
So Connecticut is fortunate enough to have one single contact center. So by dialing 211, no matter where you live in the state of Connecticut, you will be dispatched to our Rocky Hill call center. And our database of community resources serves all Connecticut residents. So within our database, we have resources from every corner, every city, every town and village across the state that can serve residents in need. So we are a statewide service. United Way of Connecticut is a statewide entity. The way that we're broken up regionally is through those local United Ways. So once again, we are the state association for Connecticut's 15 local United Ways. And depending on where you live, there's different United Ways that you can work with. So there's United Way of Northwest Connecticut. There's United Way of Greater Waterbury, United Way of Greater New Haven. In Jeff's neck of the woods, it's United Way of Central and Northeastern Connecticut, which is Paula Gilberto is a champion for Connecticut and really for Hartford. So what I'll do that would be helpful is I can drop a link to our Connecticut United Ways website that lists all of the local United Ways, and I'll have a link to their website and list the towns that they serve. That might be a good way to kind of show you guys where to turn to if you are ready to give, advocate, or volunteer.
Great. Thank you, Annie, for that. If you want to just put that in the chat, that'd be great. Dan, do you have a question?
No, actually, I just wanted to build on Bonnie's question, or to provide another answer. I volunteer both at the Cathedral with our feeding program and at Hands on Hartford. And I don't think it's fair to even consider what the past years have been. And our numbers in the winter have gone down for everything. I mean, always. Summers are high, like Annie said, with school and stuff, but can we count on the kids staying in school and continuing to get the backpack programs or the school lunches? And this year, I don't think we can. And the numbers are probably a little bit lower right now at Hands on Hartford for not the pantry so much, but for the community meals. But are there going to be more people that are unemployed and seeking services? So I think it's impossible to guess what the numbers are going to do in 2020, 2021. Also, in the past, this time of year, we've gotten massive donations from churches to keep the food pantry stocked. And so far, I have not seen such massive donations come in. And I have a feeling with churches not meeting regularly, that might not happen this year. Usually I would say, don't donate now, donate in the summer when people tend to forget about us, and around the holidays, they remember, oh yeah, let me be good. Well, now I think it's around that we have the need, and Jeff can, correct me if I'm wrong, but that's.
No, you're spot on, Nancy. That's exactly right. And, we've created an Amazon wish list to make it easy for people to just click and donate, and you can send us items that we need. And, we can get that out to folks. But yeah, you're absolutely right. You hit the nail on the head, Nancy.
Thank you. Are there any other questions or thoughts? Actually, I want to jump in real quick. Annie, is there a way you can provide that graphic of the percentage increases, or is there a way to access something like that we can maybe share within our context, just to show like such a drastic increase in like the needs of Connecticut?
I can, Dylan, I can send you the slides for sure, so you have them. But also we have a website it's pretty cool, and I'll drop that link in. It's called 211 Counts, and the URL is ct.211counts.org. And it's our online data dashboard of all of our 211 website and call data. And you can filter the dashboard by zip code, by school district, by town or city, by county, by different legislative districts. And then you can filter by custom time frame, or by yesterday or last week, just to look at data to get information about what the top needs are in your community and what the top needs are statewide. So I dropped that link in there, and what I'll do is I'll include a flyer about sort of how to use that dashboard when I follow up with the slides.
Yeah, that'd be awesome. Thank you.
And if anyone has questions, feel free to share my email too, because I'd be happy to provide additional guidance if needed.
Wonderful. I appreciate that. Aaron, did you have I saw you waving.
Yeah, Annie, I was wondering, as far as 211 goes, hearing that you have different regional offices for 211 itself, I'm curious to know also, when people call for food, are there other pantries and such that you partner with that are outside of United Way? How does that relationship work?
So we have one central 211 that serves the entire state. Our United Way network is broken up into different regions. So in our 211 database, if you look type in food or food pantries, it will give you not every, but almost every food pantry across the state of Connecticut. And we, the two major food banks in the state of Connecticut that provide food to most pantries across the state, require those food pantries to register and maintain their information with 211. So we have about 400 food pantries that serve the state of Connecticut. There's always going to be those smaller ones that don't want to be listed because they're fearful of being overwhelmed by traffic, or because they have their core group of individuals or their core community they serve. But if you go to 211ct.org and click on our food category, or type in food right into the search box on the homepage, you'll see a long list of food resources that you can point people to.
Is there a way that parishes that have pantries or soup kitchens, if they don't find themselves on that list, can let you know?
Absolutely. And I feel like I'm just sharing all these links right now, but I'll drop that in. We do have an agency update and add your agency link that you can just fill out a quick form to be added to our database.
Awesome. Anybody else with any thoughts? Jack.
Well, I already spoke. I see Mr. Horan had his hand up. Maybe he
Oh, sorry, go right on. Sorry, I missed
Appreciate that. So Jeff and Annie, I want to thank you both for your time tonight. Very interesting and educational. I'm John Horan. I'm from Vernon. So Jeff, for you, I guess, did I understand correctly that you're not currently taking any government support?
Well, we do get government funding for our housing services, but and we'll take well, I shouldn't say any, but we will take government funding when we can get it, and we constantly are applying for grants for government funding, private foundation funding, you name it. We have a grant writer that literally occasionally sends me emails at 3 a.m. on grants that she's working on. It's unbelievable. So we'll take money with some exceptions from wherever we can get it, including government. But I say that just to sort of highlight that I think people have a perception that nonprofit providers that are providing food to people who are hungry are getting government funding to do that. And the reality is they largely aren't. All of our food programs, so our food pantry, our hot meat, what you might call a soup kitchen, but we call it community meals. It's hot meals for people who are unsheltered, our food pantry, and our nutritious backpack program that serves 9 schools in Hartford. All of those food programs do not receive any government support. They are completely reliant on faith groups, individuals, foundations, corporations, et cetera. So we're not opposed. In fact, we would love government support. It's just the reality is we just don't have any. And so I share that only because I think people have the notion that the government is providing tons of money to nonprofits to meet these very basic human needs. And the reality is that just isn't the case on the ground for us at Hands on Hartford and for many other providers. But we'd love to change that at some point.
Thank you. I know in the past there's been some issues with some of the outreaches. I think there were state regulations around sobriety and stuff like that. I just wanted to see if there was some philosophical or religious restrictions that prevented. So you're open to it, you're working on it, it's just not happening. Okay, thank you.
Absolutely, yeah. And I know what issue you're referring to. That was an issue for MAC Charities in Manchester. There have been issues where nonprofits and government have butted heads over certain regulations, but no, we're open to government support. It's just the reality is there isn't a lot of government support for food programs, food for providers that are in the space of food right now.
Okay, I mention it because this group maybe could lobby for you if there were some preventative issues, but there's nothing like that.
Yeah, I mean, we do have an advocacy role, and I think that I think there is an opportunity for that. But I think, just being ambassadors within your congregations and within your personal your personal sphere of influence can be very powerful as well. But yeah, advocacy with government is extremely important. So absolutely.
Okay, thank you.
Back over to Jack.
Yeah. So for Jeff in particular, at Good Shepherd at the church, we have a mission to support our neighbors or help our neighbors when we can. But right now it's particularly difficult for a number of reasons. One is we're not there. We're not having live services. And there's nobody in the office. Everybody's working from home. So where we have normally had people show up who are in need, now if they show up, they just see a locked door and a sign that says, send us an email. But we do have money, some, not a lot, set aside to help people with housing and utilities and food. And we actually have a particular kind of orientation toward providing help for people who Hands on Hartford has identified as being in need, because we don't have much screening capability of our own. So I'd like you to know that if you have people who would be helped by, a supermarket gift card or a contribution toward a security deposit or a rent or a utility bill or something, you can get in touch with us through our main number, and it'll take a few days to get oriented or get organized around that, but we can provide some help.
Yeah, that's extremely appreciated. And we have people with those needs for sure right now. I mean, I could connect you with our program staff and we could make that happen right away. We do utility assistance, rent assistance, and food, all the things you mentioned, security deposits, rent, utility assistance, and food. We're in all those arenas, and we have folks with those needs right now. So absolutely, I can connect with you offline, Jack, and we can make that happen, but it'll make a big difference, and we really appreciate that.
Sounds good to me. My email's in the chat.
Okay, thank you so much. That's extremely appreciated.
Okay, so being mindful of time, I know we're going to explore what might be next for us and what might be helpful. So I'm going to just pass over to Bonnie, if that's okay.
Thank you. One of the other things that I did want to talk about quickly is to say that through Angie, we have learned more about farm to family food box program. And please look in ECCT e-news coming up next week. Hopefully there will be information in there regarding the farm to family food boxes, which do have perishable items in it. But for food pantries, for churches that have food pantries, there is a contact that you would be able to use to find out if there is a truck of food that is being delivered in your area where during a certain period of time you could pick up food boxes to distribute through your food pantry. It's 1 day a week. You may have to do something related to changing your food pantry hours in order to manage the perishable items for the distribution for that. But it is another way that small parishes can help their neighbors. So what, excuse me, what we're wondering at this point in time is we have had several calls where we've had information, and I think that the information has been beneficial to a lot of us. We are interested in knowing if we can have other speakers come and talk to us, what you would like to hear about related to food ministry. Would you like to consider having those who have come out of who had used shelters and come out, talk to us, as in the program that Jeff had been talking about? Would you like to hear some about victory gardens? We do have also coming up very soon, in January, I believe it is, a community garden program that is going to be a webinar or a Zoom presentation that you'll be seeing notice about. But what types of things would you like to be able to learn more about so that we can help you?
I see that Carolyn Happy's hand is up. So Carolyn, do you want to jump in?
Quick question regarding farm to family boxes. I am under the impression, I would love to be wrong, but I'm under the impression that at least this, unless I have the wrong thing, is paused, or at least it's dramatically reduced. Can anybody confirm that? Because here in Bethlehem, we were receiving an extraordinary number of boxes, and we had enough that I was able to then bring them to Woodbury for the families served by St. Paul's, by the meals from Camp Washington. And Rick Wood at Caring for Bethlehem here in the Congregationalist Church said that it was actually right after the election that the funding had gone to 1/4 of what it used to be.
Yes,
Isn't
it did.
Yeah,
It did.
which is
the
really
content-
terrible.
It is. I'm trying to bring up my document.
We've got Angie on the call here too. She might be able to speak.
Yeah, that is true. It was decreased by about 1/4 of what was previously granted. And it's a new vendor as well. But that so far is what's been approved.
Yeah. Okay, I just wanted to confirm that because it was good that Bonnie brought it up, but it's really a drag that something that was really helpful, at least here in Bethlehem, where we're not able to rely on it like we once were. It went from feast to famine because we had so many boxes. We were regularly going to Waterbury, either via St. Paul's or directly. And then all of a sudden, poof.
Yeah, it's an unfortunate situation, but we were awarded 1/4 of what was previously given, and I believe it's 2 trailer loads per region, and it's about 1,000 boxes per trailer load.
Yeah.
Thanks for that, Angie, chiming in. And then going back to Bonnie, does anybody have any thoughts about going forward on how we could continue to learn with each other?
Just a note that I put in the chat, the information about the Community Garden Ministry Network Catch Up and Startup in the chat. And you can reach out to Letty Nagels or Reverend Virginia Army. Both of their email addresses are in the chat, and the registration for the event is also there.
Great, thanks, Maggie. And then Anne, I saw you had your hand up.
Because I'm in Litchfield, but I live in Morris, I'm very specifically interested in rural poverty and rural food insecurity, which is harder to scope out because you can't see the people who are hungry and they don't always want to come and present themselves visibly for services. So I would love to have a program that would address the various issues related to that at some point.
You read my mind on that, and I've just been thinking about, because our Northwest region is very different than the North Central in a lot of ways. We have some cities, we have Waterbury and Torrington, but then we also have vast of rural. Annie, could you speak to that? Maybe is there anything that you know of that could connect us with some sort of rural food insecurity or groups like that?
Are you looking for data around food insecurity, or you're looking for a group that can speak to it? Because I can scratch my head on the group.
Either or, both and would be, yeah. And it
So-
doesn't have to be now, but just to think
Okay.
about, yeah.
Yeah, let me think about maybe a good group or someone that could speak to that. You can use our 2-in-1 data dashboard to look at, town by town, zip code by zip code data around requests for food, and also there's a column on the far right of the screen that shows unmet need percentage. So if someone from Morris dialed 2-in-1 looking for a food pantry and we weren't able to connect them with a food pantry, that we would document that as a need unmet. So that's one way to kind of just gauge the level of food insecurity based on calls we're getting to 2-in-1. And I know that it's tough right now to get data. I'm struggling with that because this situation is on top of us, and getting historical data doesn't do justice to the problems that we're currently facing. So a lot of the hunger, ending hunger and things like that show percentages of food insecurity are definitely outdated right now. We know that the problem is so much bigger. But let me, Dylan and Ann, I'll get back to you with maybe some possible speakers or some possible organizations that could speak to that.
Thank you.
Yeah, that would be
No
wonderful.
problem.
Thank you.
Of course.
Lita, you have your hand raised.
Yeah. We addressed that program in Wolcott years ago, but it's kind of hard now because the school system is so scattered. But we use the social service person in the school system to recommend to our church who were in need of assistance, but were a little bit shy about saying it. So that's how we reached to most people that didn't want to come forward and says, I need food or I need help. So they did through the school system with the social workers. They would recommend a lot to us.
Thanks, Rita. And I can speak that Angie's on this call, and she's been amazing and critical for all the work that we've been doing. And so I can't speak to that enough. So thank you. Thank you for raising that. Anybody else? Carolyn.
Sorry.
Oh, you're muted still.
Sorry. I just wanted to say hi to Anne in Litchfield at St. Michael's. She's our she came and she was there that day, Dylan, as you may recall, when Caring for Bethlehem gave a little tour of how they do things. And one thing, if you'd like, Anne, is either I can ask Rick Wood a little bit more about how he gets the information that he gets, because it is 100% true what you're saying, that it is very hard when people are rural and don't have cars to be able to serve them. And I know that in Bethlehem, it's mostly through word of mouth, but I'm sure there are other ways that are a little bit more official in terms of which seniors need food brought to them and which families. So I think that's a great idea for the next session, if we could figure out how people, at the end of very, very, very long driveways, don't go completely neglected out here in the rural areas of the northwest corner. Especially now that school is going to be closed again, because Bethlehem Woodbury is now closed. So we're going to be missing our link through the school social worker, as Oida pointed out, is an excellent resource until it's not. So.
Yeah, thank you. This gives us a lot to think about going forward. And I really sense the need to look at, our rural neighbors and communities. Anybody else have any thoughts? I want to be mindful of time. So this has been great. I've learned a lot. It's been thought provoking, and before we pass it off to Bonnie, Erin, do you have anything else you want to say before we pass it to the closing prayer?
I just wanted to express gratitude to both Annie and Jeff for spending the evening with us. You guys are doing incredible work, and so it's really grateful to know how we can support you, but also really grateful that you're painting a picture for us. We know that the challenges are great in front of us, but it's wonderful to have some concrete stories to go with that. So thank you very much. And we are working with Angie to try and figure out if we have a couple of speakers for December. I don't know if we've quite gotten those firmed up yet, but we have all your information in the chat. If you haven't put your email in, please do so now, and we'll make sure that you get information about the next conversation, and we'll certainly take into consideration the question of the rural. All of our regions do have rural areas, so it's certainly something we need to think about together. Thanks, Dylan.
Thank you. And again, thank you, Annie and Jeff. I really appreciate your time. So with that, Bonnie, would you take us home?
Yes, I will. Let us pray. Gracious God, we thank you for the blessing of food, water, shelter, family, and well-being. As we enjoy healthy food, we will think of those who struggle to feed their families every day. You taught us to pray as we say, "Give us today our daily bread." We make that prayer also for the millions who go hungry every day. You fed the hungry. Inspire in us the commitment to follow your example, showing compassion in action and sharing what we have with those who have less. You cared for all. Help us to remember your command to love one another. Help us to see you in each of our brothers and sisters, especially those who are in need. You are the bread of life. Strengthen us as we work for justice in the world. Help us to stand in solidarity with the poorest of the poor. You came so that we could have life and have it to the full. Our prayer is that this might be true for all. We pray that communities and governments recognize our shared responsibility to be more just in sharing the world's resources. Help us to care more deeply, live more simply, and share more fully. Amen.
All right. Thanks so much, everyone. See you next time.